Attention deficit hyperactivity disorder is a neurodevelopmental disorder. It affects three main domains: attention, hyperactivity, and impulsivity. So people with ADHD have difficulties in paying attention and focusing and concentrating. They tend to be hyperactive and they tend to be over-impulsive. In children, the hyperactivity and impulsivity are often more prominent than in attention, but in adult life, inattention is often the most prominent feature. Although quite often, you get a combination of all three. In addition, people with ADHD often have mood swings and also excessive anxiety and depression. So most of the people I see with ADHD have additional psychiatric comorbidities, which are often the result of ADHD. So they will be excessively anxious or more prone to depression than other people. And indeed, they may present with anxiety and depression rather than overt signs of ADHD. People with ADHD struggle in work, and in relationships. They have difficulties in motivating themselves and have difficulties in completing tasks. There are specific difficulties in managing big projects, as they find it very difficult to plan ahead, which means that to help people with ADHD, big projects have to be broken down into smaller tasks. Adults are commonly diagnosed with ADHD. ADHD is a neurodevelopmental disorder. It starts in childhood. However, the condition is not often picked up until adult life. There are various reasons for this. One reason may be that there was reduced awareness of ADHD in the past, and people did not think of making a diagnosis. Another reason, that childhoods can often be highly structured. Schools are highly structured environments, and children are given specific tasks they have to complete, and little is left, and quite often little is left to their initiative. Parents also provide structured home environments. When that structure disappears, ADHD often becomes overt in a way that may not have been earlier on. There are also huge benefits in diagnosing ADHD in adult life. People that I see have most of their working lives ahead of them and most of their social life ahead of them. And diagnosing ADHD in any age can make huge changes to people's lives. I've diagnosed ADHD in people in their 50s and 60s, and they have had great benefits from this. It is therefore never too late to diagnose ADHD, and people can always benefit from appropriate treatment and guidance. The other reason for diagnosing ADHD that helps people become more self-aware and understand the difficulties that they've been struggling with. The diagnosis itself, even without treatment, can improve self-esteem and help with anxiety and depression. People with ADHD are easily distracted. They find it very difficult to focus on anything. The mind tends to wander a lot of the time. So for example, somebody with ADHD will sit in front of a computer to perform a particular task, but will be distracted by emails, messages and other websites, and will not complete the task they set to do. Another area of difficulty for people with ADHD is procrastination. Difficult tasks are put off, and people with ADHD find it very difficult to split a task into its components. This means that they tend to put things off until the last minute before a deadline. Quite often they miss the deadlines, but it can also mean that the work is of poorer quality than it otherwise would have been because it's done too quickly. People with ADHD tend to lose and misplace things, so they forget to take things with them, but they also forget where they've put them. So my patients with ADHD will often complain of losing mobile phones, credit cards, and misplacing their glasses. Another area of difficulty of patients with ADHD is that they get bored easily. They therefore find it very difficult to queue. They'll go to the supermarket, and if there are queues everywhere, they may abandon the trolley and not finish their shopping. This can also result in people having difficulties with speeding and having excessive penalty points on their driving licenses. The NICE guidelines on treating adult attention deficit hyperactivity disorder suggest that the first step is making environmental adjustments. Once that has been done, I recommend treatment with medication. The medications for ADHD all increase dopamine levels in the frontal lobe of the brain and restore the dopamine levels to what they would have been in somebody without ADHD. This means that people with ADHD, once on medication, can have improved concentration, improved motivation, and are much better at completing their tasks. Medications commonly use are methylphenidate, the branded name of which is Ritalin, and dexamphetamine. I tend to use long-acting medications, which means that people do not need to take medication several times a day. These medications are taken in the morning and can act for between 8 to 10 hours subsequently. They help people get through the day and function and complete their tasks. This can lead to dramatic transformations in people's lives. People can manage exams much better and have also improved interpersonal relationships and have an improved performance at work. These medications are highly effective with a positive response in between 70 to 80% of patients. They also have very few adverse effects. The other factor to bear in mind is that these medications are not addictive. Patients do not, on the whole, develop a tolerance, and once a dose of medication is established, people can continue taking those in the long term.